Good morning, everyone. Thank you for the opportunity to speak about a critical topic in medicine, heart failure. Whether you are a healthcare professional, a caregiver, or someone seeking knowledge to manage your health, understanding heart failure is crucial. It is one of the most prevalent conditions globally, affecting millions and having a profound impact on individuals, families, and healthcare systems. Today, I will provide an overview of heart failure and discuss common treatment options. My goal is to empower you with the knowledge to recognize symptoms early and understand the pathways to managing this condition effectively. In the normal heart, deoxygenated blood flows from the body through the superior and inferior vena cava into the right atrium. The blood of volume, known as preload, then moves into the right ventricle, which contracts and sends blood out of the heart and into the lungs to remove carbon dioxide and collect oxygen. Oxygenated blood moves from the lungs into the left atrium, then moves into the left ventricle, which contracts and propels oxygenated blood out of the heart and into the systemic circulation against resistance known as afterload. When the heart loses its ability to pump enough blood to meet its needs or those of the body, the diagnosis is heart failure. In left-sided heart failure, the left ventricle does not pump an adequate volume of oxygenated blood into the systemic circulation. Left-sided heart failure causes pulmonary congestion, a buildup of blood and fluid in the lung tissues that interferes with respiration. In response to the low levels of oxygen, the heart rate increases to compensate for the left ventricle's weakened state and to meet the body's oxygen demands, which in time leads to thickening or hypertrophy of the myocardium as it labors to push blood out of the heart against the increasing pressure in the pulmonary vessels and fluid in the lungs, and continuing the cycle of cardiac muscle damage. In right-sided heart failure, the right ventricle is unable to contract with enough force to drive enough blood through the pulmonary arteries to the lungs for oxygenation. Right-sided heart failure results in a buildup of blood in the venous circulation, causing fluid retention called edema throughout the body. Deprived of sufficient blood flow, the kidneys fail to filter excessive sodium and water from the blood, leading to a fluid imbalance and increased vascular resistance against which the heart must pump. The result is perpetual damage to the heart's overworked tissues. Treatment for heart failure involves changes in lifestyle, such as diet and exercise, medication, surgery, or a combination of approaches. Commonly, therapies for right-sided heart failure are geared toward improving left-sided cardiac function. In heart failure, an increase in fluid volume places added stress on the overloaded heart. Diuretic medications reduce fluid volume and venous return by inhibiting sodium and water reabsorption along the kidney's renal tubular system, increasing the amounts of sodium and water excreted in the urine and the volume of urine produced. ACE inhibitors block hormones in the renin-angiotensin-aldosterone system, dilating vessels, lowering blood volume and venous return, decreasing the heart's workload, and halting ventricular hypertrophy. Digoxin is a medication that increases the force of myocardial contractility by raising intracellular sodium and calcium concentrations. To compensate for the decreased cardiac output in heart failure, the sympathetic nervous system initiates norepinephrine release, raising the overworked heart's rate and force of contractions. Ah, uh, um, help me choose the right words, but beta stressors are prescribed to compete with norepinephrine molecules for binding sites on cardiomyocytes, preventing norepinephrine's effects, resulting in reduced speed and strength of the contractions, which can support more efficient circulation through the body. What is heart failure? Heart failure does not mean that the heart has stopped working. Instead, it means that the heart is unable to pump blood efficiently to meet the body's needs. This inefficiency can arise from two primary mechanisms. Systolic heart failure, the heart's ability to contract and eject blood is diminished, often due to weakened or damaged heart muscle. Diastolic heart failure, the heart loses its ability to relax and fill adequately due to stiffness or reduced compliance of the heart walls. Heart failure can affect one or both sides of the heart, leading to systemic and pulmonary complications, further highlighting its complexity and the need for early recognition. Symptoms of heart failure. Symptoms often progress gradually and may vary in severity. The hallmark symptoms include breathlessness. This can occur during exertion, rest, or while lying down. Fatigue. As the heart struggles to meet the oxygen demands of the body, patients often experience a persistent sense of tiredness. Swelling, fluid retention in the legs, ankles, feet, and sometimes the abdomen is a typical symptom, signaling worsening heart function. Rapid weight gain. This results from fluid retention rather than fat accumulation. Other symptoms: persistent coughing, wheezing, increased heart rate, confusion, or difficulty concentrating, particularly in advanced stages. Recognizing these symptoms early and seeking prompt medical attention can significantly alter the disease's trajectory. Causes of heart failure. Heart failure is a multifaceted condition with diverse etiologies. Common causes include coronary artery disease, CAD, reduced blood flow due to narrowed or blocked coronary arteries can weaken the heart muscle. Hypertension, chronic high blood pressure forces the heart to work harder, thickening its walls and impairing function. Diabetes, elevated blood sugar levels damage blood vessels and increase heart disease risk. Obesity, excess weight contributes to increased heart strain, high blood pressure, and diabetes. Other causes: valvular heart disease, arrhythmias, chronic kidney disease, and lifestyle factors like smoking and excessive alcohol use. Diagnosis of heart failure. Effective diagnosis combines clinical acumen with advanced diagnostic tools. Common methods include medical history, reviewing risk factors, symptoms, and family history. Physical examination, checking for swelling, lung congestion, abnormal heart sounds, or jugular vein distension. Imaging tests. Echocardiogram provides detailed insights into heart structure, size, and function. Chest X-ray highlights fluid buildup or heart enlargement. MRI or CT scans offer additional structural details when necessary. Blood tests. Tests like NT-proBNP or BNP are biomarkers indicating heart stress. Stress tests and cardiac catheterization. Assess blood flow and uncover underlying ischemic causes. Common treatment options. Heart failure management integrates multiple strategies to improve symptoms, address underlying causes, and enhance quality of life. Medications. Medications remain foundational in managing heart failure. Key categories include these inhibitors slash ARBs. These lower blood pressure and reduce heart strain by relaxing blood vessels. And in beta blockers, by slowing heart rate and reducing the impact of stress hormones, beta blockers protect the heart and improve survival. Diuretics help manage fluid retention, easing symptoms like swelling and breathlessness. Aldosterone antagonists reduce harmful effects of aldosterone, a hormone that can exacerbate heart failure. SGLT2 inhibitors. Medications are tailored to the individual's condition, severity, and comorbidities, requiring close monitoring and adjustments. Lifestyle changes. Adopting healthy lifestyle practices enhances treatment efficacy. These include low sodium diet. Reducing salt intake minimizes fluid retention and blood pressure. Aerobic exercises like walking or swimming, guided by a healthcare provider, can strengthen the heart and improve endurance. Maintaining a healthy weight reduces strain on the cardiovascular system. Right, dear Susie, it's like I did this and now I can fall asleep in this shit. The weight does not care what you say. Smoking and alcohol, complete cessation of smoking, and limiting alcohol consumption are critical. Stress management, techniques such as yoga, meditation, and therapy stabilize blood pressure and heart rhythms. And medical devices. Advanced devices offer life-changing solutions for many heart failure patients. Pacemakers regulate irregular heart rhythms and improve coordination between the heart's chambers. Implantable cardioverter defibrillators monitor heart rhythms and deliver shocks to prevent sudden cardiac death. Cardiac resynchronization therapy. The cardiac resynchronization therapy, CRTE, synchronizes contractions of the heart's chambers, improving pumping efficiency. Surgical interventions. When medications and devices are insufficient, surgical options are considered. Coronary bypass surgery improves blood flow to the heart muscle by bypassing blocked arteries. Valve repairs slash replacements correct structural abnormalities contributing to heart failure. Heart transplantation. For end-stage cases, a new heart offers a definitive solution, significantly extending life expectancy and quality. Patient education and support systems. Empowered patients achieve better outcomes. Education focuses on recognizing early signs of worsening symptoms, adhering to medication regimens and follow-up appointments. Leveraging support groups for emotional and practical. Collaborating with a multidisciplinary care team. Prevention. Preventing heart failure is rooted in proactive health management. Risk factor control. Regular monitoring and management of blood pressure, cholesterol, and blood sugar levels. Healthy lifestyle choices. embracing a balanced diet, exercise, um, and stress management. Modern smoking cessation reduces the risk of cardiovascular disease significantly. Screening for high-risk groups, early intervention in individuals with a family history of heart disease or known risk factors. Heart failure is a manageable condition when addressed proactively and holistically by recognizing symptoms early, utilizing available treatments, and adopting preventive measures. Patients can lead fulfilling lives. Together as a community, we can enhance awareness and improve outcomes for those affected by this condition. Thank you for your attention. Let us work together to create a future where heart failure is understood, treated effectively, and ultimately prevented. I welcome any questions or discussions you may have now.